Hello, I'm Dr. Ajay Kumar. I've done my MD pulmonary medicine and also done my fellowship in HIV from CMC Bangalore. So today I'm going to talk about HIV, what are the symptoms of HIV, how is it transmitted, and also about the diagnosis of HIV. HIV is a retrovirus which is transmitted sexually. Apart from sexual contact, which is the most common mode of transmission, there are other modes of transmission for HIV. Like it can be transmitted through injections or through blood transfusions or by contaminated instruments or through mother to child also it can be transmitted, and also it can be transmitted through breastfeeding. I'll be just showing you about the short video how the virus infects the cells in the body. This is the virus, HIV virus, HIV immunodeficiency virus, which infects all the cells in our body. It especially infects the CD4 cells, which are responsible for immunity of the person. Once the virus enters into the cell, the virus it will multiply. It will first replicate, and from RNA it becomes DNA. And this DNA virus, which then copies itself to our nucleus, and then it starts multiplying. So over a period of time, these cells starts multiplying, and it will be infecting so many cells, all the cells like for red blood cells, white blood cells, and other platelets. So the patient will have multiple immune deficiency. So you can see here how the virus is replicating itself, and every minute some thousands of virus will be infecting these cells, and within a short span of time the new virus copies will be released. So these virus copies again will be infecting other cells, and again they will be multiplying in those cells. So here you can see the virus which has infected has come out, new virus copies are produced. So once the virus infects the cells and it starts killing the cells, then the patient's immunity will be gradually will be decreasing. So then the patient will complain about symptoms. So what are the symptoms of HIV? So usually in the initial stages, patients will not have any symptoms. Patients will be absolutely asymptomatic. Later on, when the patient's immunity declines, then the patient complains of some fatigue, and they'll complain of weakness. Then later on, the patient might complain of fever, cough, and the virus, because it infects so many organs, so the symptoms will depend upon the organ of infection. Suppose, for instance, when the patient is having a lung problem, like for instance, if the patient, because of the low immunity, if he gets infected with some lung infection, he'll be presenting with cough, shortness of breath, or fever. Like for instance, if the patient is getting any headache, or if the patient is having some infections in the brain, he can present like with headache. It can present with seizures like fits, or he can present with loss of consciousness. Likewise, if the patient is having symptoms in the stomach, like sometimes patient will complain of loose motions, vomiting, then we might suspect that patient is having some abdominal infection. So depending upon the severe organ of infection, the patient might complain with various symptoms. So there is no symptom which is very specific of HIV, but depending upon the organ of infection, the symptoms might vary. So WHO has given a staging of HIV. Basically, there are 4 stages of HIV according to WHO. In the first stage, patients will be completely asymptomatic, they won't have any symptoms. When they come to the second stage, they will develop some minute skin infections, like for instance, pruritic papillary eruptions, what we call. Patients complain of itching, and sometimes they develop skin reactions. This patient has come up with herpes infection. Likewise, some patients might develop skin reactions, like if the patient is having herpes, which is very common in HIV. So when the patient enters into stage 2, they will be developing all these kind of skin problems. When the patient is not taking any treatment, antiretroviral treatment, then the patient enters into stage 3. In stage 3, what happens? The patients develop lung infections, they can develop diarrheas, they will develop loss of weight of more than 10%, they'll be having prolonged fever of more than 1 month, prolonged diarrhea of more than 1 month. Sometimes patients can develop oral infections like oral candidiasis, which is very common in HIV patients. If you see this picture, patient is having severe oral infections in the mouth. Likewise, if the patient is not taking treatment even at this stage, then the patient enters into stage 4, what is we call as AIDS stage, that is acquired immune deficiency syndrome. In this syndrome, the patient will be developing all late complications of HIV, like patients can develop severe pneumocystis pneumonia, wherein the patient will have severe breathlessness, he won't be able to sit in comfortably without taking oxygen, supplemental oxygen. Or if the patient is developing some abdominal PV, the patient can present with severe abdominal distension and patient can develop severe diarrhea. Likewise, if the patient can develop multiple malignancies like Hodgkin's lymphoma, Kaposi sarcoma, these malignancies can affect any part of the body. They especially have predilection for brain. Once the patient develops malignancies, it's almost in a very late stage. So by seeing the symptoms also you can tell what stage the patient is in. Yeah, so these are all the symptoms seen in HIV and complications. So in the next video, we'll be talking more about the complications of HIV, how to diagnose HIV and how to treat HIV and what are the prevention steps that can be taken to prevent HIV. I'm thankful to Lybrate for providing me this opportunity to reach patients all over India. If you want to contact, you can contact me at Sai Srinivasa Hospital at Narayanguda. It is beside Deepak Theatre in Hyderabad. Or you can contact me through Lybrate or my website www.hivaidsclinic.in. Thank you.